Hi, David here in downtown Cleveland at Reform Physical Therapy and Pilates. So this week we are talking about impingement syndrome of the shoulder. I see this all the time in my patients, and it can be very troublesome for people, especially that are either overhead athletes or workers that have to spend their days reaching overhead, such as electricians, painters, etc. So I just want to go over here today on Therapeutic Thursday about the 4 things that I go over with people on their first day to see me, on their evaluation day. So number 1, I make sure I tell them you do not want to just grind through this pain. You want to start to avoid the things that bother you the most. So if you can avoid some of those overhead positions, don't just think that you need to keep going over to try and keep working through it, because that's not going to work. It's just going to become more and more irritated. You need to start taking yourself away from those painful activities. If you really can't, if you have no option, then decrease the amount of time you spend in those positions or the frequency of repetition that you do it. That's an option. At one time, try to do it. So number 1, start avoiding painful things. Sounds pretty common, but a lot of people don't do it. Number 2, using ice for pain control. By far, it's not going to cure your impingement syndrome. However, it does numb your sensation of pain slightly. So using it for 10 minutes, 15 minutes max, just to kind of get to a numb state is something I recommend to people, just so that they can not have to maybe take some medication. Something that you don't have to process through your body and still get some pain control is a good thing. So using some ice to maybe calm down is not a bad thing. Number 3 is do your exercises. So do the exercises that I give you as a physical therapist. I'm not giving them for me, I'm giving them for you. So it's important to do it. Also, think of these exercises more like medication rather than exercise. They are meant to heal tissue. I am giving you something that's going to try and stimulate healing and decreasing inflammation, improving circulation. It's not just about strength and muscle bulk. This is more like medicine. So we'll talk about more exercise that we could do for impingement syndrome on Fitness Friday. Number 4, which I'll show you today, is sleeping position. So many people say that they have pain with impingement with sleeping and they can't sleep, it hurts them. So, especially if it's become really irritable, that's the thing. So, number 1, don't sleep on the side of pain, okay? Try to stay off of that side if you can. So, laying on your back, laying on your stomach, or laying on your opposite side, your non-painful side is important. I'm going to show you now the preferred way I tell people to try and set up to sleep. Let's say that my left shoulder is my painful side. I'm going to go onto my right side. I'm going to take 2 pillows. I'm going to have one folded over and one long, so that my left arm can be on top of that pillow. I might even use more. I want my arm to be propped so that it is in a very comfortable and loose position in my arm. If you take this arm and you just wrap up the pillows like this, my shoulder is all stretched out. There's tension through the tendon that's already irritated from my impingement syndrome. This isn't going to feel great. So I want to have it back by me. I want to have enough support so it feels like it's in a very loose position. There's not a lot of tension through my tendon. And I could typically have my clients sleep like this pretty comfortably, and they're pretty happy. So, just to recap, avoid painful activities, use ice as needed, do your exercises, and sleep with support and off that shoulder. And this should be a good start to helping you get some relief from your impingement syndrome. Thank you.